Welcome to the NHPCO's We Honor Veterans Partner Networking call. During the presentation, all participants will be in a listen-only mode. Afterwards, we will conduct a question and answer session, and you will have the opportunity to share your stories. At that time, if you have a question or comment, please press star 1 on your telephone to enter the phone queue. As a reminder, this conference is being recorded. I would now like to turn the call over to Catherine Kemp. Please go ahead.
Hello, everyone, and welcome to our fall quarterly partner networking call for We Honor Veterans. Here at NHPCO, we have Hope Fost, who I'm sure many of you have interacted with online and over the phone. She's our program coordinator. We also have Amanda Bowe, the director of our communications team, and she'll be giving you some updates on Veterans Day resources for you to share. Also on the call today, we have Bayada Hospice's May Kumora, who will be speaking about her Veteran to Veteran Letters of Thanks initiative. We also have Kathy Van Pelt from, many of you are familiar with Deborah Grassman and her organization Opus Peace. So she'll be giving us some updates and upcoming events and just sharing some general information for our partners. And then, of course, we have our trusty friend, Dr. Scott Shreve from the Department of Veterans Affairs, here to give some updates and answer any questions you all may have. So we're looking forward to that, and thank you again to all of our speakers for being on. One last shout out, I wanted just to say welcome to the We Honor Veterans family to our 2 new community partners. We have Washington Square Healthcare in Ohio, as well as Oasis Dementia Care in Indiana. So I hope you all were able to make the call, and again, welcome again. Okay, well, without further ado, I'm going to hand the phone over to Amanda for some communications updates.
Thanks, Catherine, and good afternoon, everyone. Thanks for being with us today. I just want to talk a little bit about the Veterans Day resources that we have created for you to use for your Veterans Day outreach and to promote what you're doing for that special day. You'll find these resources on the We Honor Veterans website, and you get to them by clicking on the top on the home screen. You'll click on the toolbar where it says Get Practical Resources, and then it'll prompt you We Honor Veterans Partner Resources, and then you'll see a list of all the available resources that we have, and you'll find Veterans Day resources listed. I know that's a lot of steps, and if you have any questions at all, you can email veterans@nhpco.org, and we can point you in the right direction. But under those resources, you'll find social media graphics. Right now, posted are the graphics that we used last year, but we will have a brand new set of Facebook and Twitter graphics for you to use. And you'll notice on each of the graphics that the hashtag We Honor Veterans is present, but we do ask that if you post anything on social media to make sure that you use the hashtag We Honor Veterans so we can track the posts that are done for Veterans Day. You'll also find a press release that you can customize to your organization. There's a quote in the press release from our CEO and President, Don Schumacher, and feel free to, edit and change the press release. And, we would love to see what you've done with it. So if you want to send us a copy, again, that email address is veterans@nhpco.org. You'll also find an op-ed letter that can be sent to your local media. And there's also a We Honor Veterans listicle that was created in-house here at NHPCO. And there is a space at the bottom of the listicle that you can stick your logo on, and you can use that for outreach, if you're doing a veterans community fair or any type of promotional outreach that's there for you to use. And we encourage, if you're doing any type of pinning ceremonies or anything special for Veterans Day, we want to hear your stories. Please send them to us. Please send them to veterans@nhpco.org, or you can go on the website and just click that Submit a Story button. We just really love to hear from you, and we love to get your stories and share them, so we definitely encourage you to do that. So again, veterans@nhpco.org if you have any questions, and you can also email me. My email address is abow@nhpco.org. So thanks so much.
Yeah, thanks, Amanda. Alrighty, now we're going to go on to May Kumura, where she's going to discuss her Veteran to Veteran Letters initiative.
Hi, thank you. Hello, everyone. My name is Mayumi, or May Kimura. I'm the bereavement coordinator slash social worker slash veteran, in-house resident veteran with Beata Hospice. And so this was really just a small pet project that turned into something a little bit bigger, and we hope to make it larger and also to share it with the community, the hospice community as well. A couple of years ago, we had a World War II vet who had some time in Germany, and right in the last couple of days, he was having a lot of trouble, quote, letting go, and the thought was that he had a lot of guilt due to what had happened when he was serving, but really didn't feel comfortable talking with anyone about it. So I had the idea. I had a friend at that time who was stationed in Germany, who was an active duty military personnel, and he was working hand in hand with the German military, and it was a very different time than what World War II looked like. So I thought maybe it would be a good idea to have my friend Eric write this letter saying, thank you for your service. You know, this is what it looks like now because of the sacrifices and what you've done, and you're not forgotten. Your service is not in vain. So basically I gathered the collected the letter. Unfortunately, it didn't make it in time, but I found that letter, I used it for another, and I sent it to another veteran who was also in World War II, and it brought a lot of just a letter of thanks for what they did from someone who was out there now, still in uniform. Was just they were very appreciative. So what I did was I continued to collect more letters. At this point, we have about 10 to 12 letters from some of my friends who are all stationed around the world. So I thought I'd just maybe read a paragraph or two from the letter that my friend Eric had written. I have a letter myself, but I think his is so beautiful, so I'll read it very quickly. So he wrote, I am currently serving in the United States Navy at the rank of Petty Officer First Class, which is a pay grade of E6. I've served for 7.5 years, and I'm currently stationed in Stuttgart, Germany, where I live with my beautiful wife, Jamie. We've lived in Germany for 2 years, and it is an amazing land with people that are very warm and welcoming. I even have the opportunity to interact with members of the German military, and it's been a great experience as well, one that also involved a lot of delicious German beer. Despite the great experience I have had, the history of this place is not lost on myself nor any of the people here. Truth be told, it is amazing to think that it wasn't that long ago that most of Europe was covered in war and suffering. Despite that, the land has healed, and outside of some locations that have been preserved for the sake of history, you cannot even tell that the 2 world wars have been fought in a century's time throughout these lands. Outside of my house, especially in the summer when I leave it open all day, the sound of children play is constant. I can only imagine that such sounds would have been thought to be impossible during the war. This is a testament to what you and your comrades have accomplished through great sacrifice. You have given the world a future and a chance at making things better than they were. Though things today are far from perfect, I truly believe we can improve, for I have seen it with my own eyes. So that's just a snippet, and that's Eric Wagner, Petty Officer Second Class. So I share that letter with you today, but I would love for anyone who's interested, I would love to share these letters with you so that you can then implement it in your own We Honor Vets efforts. My goal as well is to continue to collect letters, as well as I'm hoping even videos, just saying thank you from active duty, other veterans. So I'm hoping that maybe there might be people out here on this line that could help me with that as well. I find that a lot of the people that I ask, it's not that they don't want to help, it's that they don't feel that their words are eloquent or meaningful enough. So if you all can help me, that would be great. But please, if Catherine would probably share my information, I can get those letters to you, or they'll be put online. So that's it. Thank you.
Well, thank you so much, May. We're extremely grateful for your work and that of your fellow servicemen in writing those letters. We have actually put those up on our website now, so they are available for all of our partners to use if they would like. The link will be coming out in the networking call notes. You're also free to email us, and we're happy to send those on as well. And like May said, we'd really like to collect as many letters as possible and make these as available as we can. So if you know anyone who's interested in writing just a small letter of thanks or as she said, sharing a video, please reach out to us. We'll get in touch with her as well as make them available on our website for our partners. So thank you so much for that. Okay, now we have Kathy Van Pelt with Opus Peace with some updates.
Okay, thank you so much, and good afternoon, everybody. Thank you, Catherine and NHPCO, for inviting me to participate on this networking call. This is really very exciting. I've been on many of these calls over the past 5 years as a listener, as the Veteran Care Liaison for Ohio's Hospice of Dayton, which was one of the leading partner level 4 hospices in the country, having received an honorable mention recognition at the We Honor Veteran 5th Anniversary Celebration, which was just a year ago, last October 2015. And I now have the exciting opportunity to join Opus Peace, which is a nonprofit organization founded by Deborah Grassman, the author of Peace at Last, Hope and Healing for Veterans and Their Families, a highly recommended book listed on the We Honor Veteran website as a resource, as well as many of Deborah's PowerPoint presentations that she has created. I believe her most famous was Wounded Warriors. Opus Peace was founded 2 years ago by Deborah when she retired from the Bay Pines VA in St. Petersburg, Florida, after 30 years as a nurse practitioner on the hospice unit at the VA, caring for, as she says, over 10,000 dying veterans. Caring for dying veterans, hospice teams across the country are aware of bearing witness to the sacred stories of war, as well as the sacred stories of trauma, which can be held in the body for many, many years and often manifested in the physical symptoms of uncontrolled pain, nightmares, terminal agitation, out-of-control anger, possibly indicators of a delayed or undiagnosed post-traumatic stress disorder or PTSD. Knowing that about 85% of the veterans that we're caring for in the community hospices are not enrolled in the VA and may never have been diagnosed. Many veterans and their caregiver and the caregivers of these veterans may also be carrying soul injuries as a result of their military experience, which may not develop into PTSD. And the mission of Opus Peace is to provide educational programs to healthcare providers to help people reckon with the unassessed wounds of soul injury, thereby liberating unmourned loss and unforgiven guilt and or shame that can sabotage lives. A soul injury can be a spectrum of wounds leading to that sense of being separated from one's own self. Soul injury is defined by Opus Peace as an aching wound perpetuated by unmourned loss and unforgiven guilt or shame that is often manifested as a sense of emptiness, loss of meaning, or a sense that part of yourself is missing. The approach to addressing these soul injuries includes learning how to grieve our losses, grieve our failures, grieve our disappointments, and releasing that loss, as well as learning how to forgive ourselves and forgive others, releasing that shame. I frequently, when my presentations that I've given over the past 5 years, refer to Ira Byock and his tasks of dying. And one of those tasks is forgiveness of self, forgiveness of others, being able to say, I'm sorry, and will you forgive me? Dying people know things the rest of us don't, and we refer to that as warrior wisdom. This wisdom emerges in the last few weeks of life. And Deborah, with the launching of Opus Peace, has felt very strongly that her mission is to carry that wisdom forward, that those veterans who have died, and sharing that wisdom with her and with all of us in community hospices, partners, carry that wisdom forward, even though so they're dying, and sharing that hasn't been lost. We haven't lost that. Opus Peace has developed educational programs and workshops based on time-honored ceremonies that facilitate hope and healing, and not only for veterans at end of life, because so many people, I've heard this, Deborah's heard this, many hospice teams have heard this, why am I just now finding this peace when I only have a few weeks to live? I wish I had known this and received this peace years ago. These time-honored ceremonies that facilitate hope and healing, not only for veterans at end of life, but all veterans, including active duty military, as well as all traumatized populations. And actually even the caregivers and our health care professionals providing the care and services to these populations may also be in need of healing from their own soul injuries. I know from my experience over the past 5 years, I've presented several times on the topic of caring for our country's veterans at end of life. I've presented information on having moved through the We Honor Veteran Partnership levels and what those activities are, and examples at Ohio's Hospice of Dayton, activities that we have that we carried out. And in the Hospice Veteran Partnership, I've also spoken on that as far as the requirement with the Hospice Veteran Partnerships and moving through your We Honor Veteran Partnership levels. And it's just interesting because we always get evaluations and ideas or suggestions for future topics. And one of the topics that I have frequently seen with my evaluations is that request for more information on post-traumatic stress disorder at end of life. Not only a description of what that is, but how do we address it? What are some interventions? And when I did a search of the literature several years ago as I was writing an article, which was actually published in the Home Healthcare Nurse in 2011, there was nothing in the literature that really spoke to addressing PTSD at end of life. There was lots of articles on post-traumatic stress, but nothing really in evidence-based interventions for end of life. And so I think I'm excited about the opportunity to work with Opus Peace as they're looking at ceremonies, therapeutic letter writing, different types of rituals that have been used in different cultures in this healing of grief and this letting go of that need for forgiveness. Even though you did what you needed to do, many veterans at end of life still need that opportunity to forgive themselves for maybe having carried out some of the actions that they had to do in order to themselves not be killed or their comrades. So recognizing soul injuries And addressing soul injuries could also be an effective intervention for this for the post-traumatic stress disorder that we see at end of life. So I know we've got some really exciting events coming soon. The Hospice Foundation of America has partnered with Opus Peace and will be offering the first soul injury webinar in January. This webinar will be released for viewing in January, and the Hospice Foundation of America is kind of stepping out of their comfort zone and partnering with Opus Peace and offering this, but it will be similar to the format, if you're familiar with the Living Through Grief series that they offer in the spring around April, where they now offer the DVD where you can, purchase and you can watch it throughout the year, and offer CEs if you have a panel discussion afterwards at a host site for review and discussion of the video. So we are very excited about that. So I just thank you for the opportunity to provide some updates and share a little bit about what the mission is of Opus Peace, especially for those on the call that may not be aware of what Deborah Grassman has been doing since her retirement from the VA.
Well, thank you for that, Kathy. I know that we here and all of our partners, I'm sure, are looking forward to see what else comes out of you all at Opus Peace.
Thank you.
I'd like to now open the line up to if anyone has any questions for May on the veteran letters or for Kathy regarding Opus Peace.
If you'd like to ask a question, that is *1 on your telephone keypad. And once again, *1 for questions or comments. And there appears to be no questions or comments at this time.
Okay, thank you, Evan.
We do have one comment.
Oh, go ahead.
Right, caller, go ahead.
Oh, I'm not certain how the prompting goes. Am I on?
Yes, go right ahead.
Oh, how do you do? It's Bernadette LaPaglia. I serve as community liaison in Naples, Florida for Hodges Funeral Home, a Dignity Memorial provider. My question is one of clarification for May and the Letters Project. I'm just not grasping, I don't think, perhaps it's a twofold outreach that as we solicit letters that either describe past or current military services, these are then posted in hopes of getting people to respond to them in gratitude. Is that how this dynamic works? I'll wait for your response. Thank you.
Hi, May. Are you still on?
Yes, I'm here.
Oh, I think May might have unfortunately left the call. So their letters initiative, again, she collected them from her fellow servicemen who are currently serving. And I think the idea and the initiative behind it was just the focus of gratitude. They wanted to have something that her fellow hospice workers could read to veterans at the end of life. And again, just expressing their gratitude from one generation to another. So with her initiative, she collected letters from her fellow Navy servicemen, and what she was asking for, and what we on our veterans are asking for, is if anyone knows anyone that would like to share a letter of gratitude as well, we're happy to make those available to our partners, so they can then read them to veterans at the end of life. Does that clear things up a little bit?
Yes, I think so.
Okay. Yeah, Bernadette, if you have any other questions too, feel free to email us.
Thank you so much.
Sure. Were there any other questions or comments, Evan?
There appears to be no other questions or comments at this time.
Okay, thank you. All right, well, I'm going to hand the floor over now to Scott Shreve with some VA updates. Dr. Shreve?
Well, I am sorry. I got called away to our hospice unit. I apologize for the delay
sorry.
here. It was
No
an urgency on our inpatient unit. I was trying to listen in both ears.
I'm sorry
If there was
about
a question, could you repeat the question?
Oh, it was just we were going to turn the floor over to you for some VA updates and then a Q&A.
Oh, super. Well, thank you. And we really had a great gathering with Catherine and others, and most of all, Don Schumacher this past Monday in anticipation of Don's retirement. And I just want to publicly say really just an immense thank you to the National Hospice and Palliative Care Organization for all they've done to make the We Honor Veterans program possible, but to the many community hospices on this call, and to hear, Kathy talk about Opus Peace and May talk about the letter writing. As a physician caring for veterans on a 17-bed inpatient hospice unit every day, it really just warms my heart to see the community really being energized by being able to care for veterans at end of life and express our gratitude for their service. So it really is great to be a part of it and to be on this call. I'm open to questions for anybody, but if I could set the stage for questions, there are two very important things on my mind, and number one is the hospice CAPS that is coming up, and some of you, I think, are probably knee-deep, if not waist-deep, in dealing with that, the survey that is being implemented, and I think will be going national within the next 6 to 12 months. I wanted to get your feedback on that, as I'll be meeting with representatives from the Centers for Medicare and Medicaid this Friday, and I would really appreciate hearing your perspective, and the reason I ask is there's a multitude of reasons, but a big one is that we'd really like to get to the point where we can compare end-of-life care as provided by VA with end-of-life care as provided in the community. So we're looking to create greater uniformity in our quality indicators, both in and outside VA. So I'm gonna stop there, and I have a second issue that I just want to plant the seed for people if you have comments, and that's an issue about concurrent care. And as some of you may know, this is a very could be a complex issue, and I'm going to try to simplify it by saying that there are no restrictions from the VA side for veterans to continue to receive ongoing palliative treatments from their VA, even while a veteran is receiving community hospice care under their Medicare hospice benefit. There are some limiting and perhaps even challenging regulations and policy issues on the Medicare side of things, which can be difficult. And what I have been pushing for is that veterans retain full access to their VA benefits as long as it doesn't duplicate in any way what is being provided in the community by the community hospice, that be allowed to occur simultaneously, hence the term concurrent care. And if anyone has run into any issues with that, I sure would like to hear about that, and I can bring them forward again in our meeting with CMS this week. So I'm going to open the floor, and I welcome questions from any direction or any perspective, and I'll do my best to answer. And if I don't know the answer, I'll work to get the answer back to you through Catherine.
And again, that's *1 for questions or comments. And we'll take our next question from Michelle August. Michelle, go ahead.
Hi. In regard to your question about the CAP survey, one of the questions that I see come back is in regards to, would you have wanted more information or more assistance with accessing your veteran benefits? And any thoughts from the doctor as far as how we help our veteran patients get access to benefits? We've worked with our local VA Medical Center's benefits administrator with limited access to him, and wondering if there's any suggestions for working through that.
I want to make sure I'm answering. I feel like there may be more than one question kind of mixed in there. I'm not aware of the hospice CAPS having any questions specific to veterans. We actually, I tried to lobby CMS to include some questions in there, even the very simple question, do you consider yourself a veteran, that we might be able to start breaking out the data versus, veteran versus non-veteran. So I'm not aware, and I haven't seen all 47 questions of the survey, so I don't, or I did, but I can't remember all of the different categories that it covered. In terms of veterans benefits, that VBA, the Veterans Benefits Administration, is entirely separate from the hospital system. And if you're talking to a veterans benefits person at a VA facility, you're pretty close to a really good source. But if that's not working for you, I think we can help you, and I welcome Catherine's thoughts. You can send an email through the We Honor Veterans website and let us know what facility you're working at and where you're having trouble kind of getting to the right person. And that probably would be my best starting point there. If it's solely related to like family member survivorship benefits, is that the way you were leaning, Michelle? I don't know whether it was more for active veterans accessing care benefits, or was this more for survivorship benefits?
This was for veterans for themselves.
For themselves, then oh my gosh, if anything has happened in the last 18 months, it's that VAs have opened their doors to access. That if you call a VA today and need to get someone resources, I really think VA has changed dramatically, and they will bend over backwards to try to help you. But if they're not, would you send an email to the We Honor Veterans website, and Catherine and I will work it out and get you some referrals?
Yes, definitely. Thank you.
Okay.
And just for your information, we are using the CAP survey right now, and I am able to pull some veteran-specific questions on there.
Oh, you've chosen to add in some veteran-specific questions. Yeah, my understanding is you have.
Okay.
Yeah, my understanding is you have that option as part of the hospice CAPS. And I can't remember, it was something of the order of like 10 or 15%, or maybe others that know more of the specifics, that you're allowed to add in some of your own questions, but that's by your choice. I don't think the core 47 questions have anything veteran-specific that I'm aware of.
Right. Okay. Thank you.
Good question, Michelle. Thank you. And then I just wanted to, I'll just add to that, on the survivorship side, because it often comes up about surviving family members, there's a local VA number that can often help you, but there are times when that number is busy or just not responsive enough. There's also a national 800 number for survivor benefits, and I'll look that up while we're talking and give that here, but a quick Google will get you to that as well.
And again, that's *1 for questions or comments. There appears to be no more questions at this time.
Wow, I'm really surprised, Catherine. That
wow, yeah. Something in the air. Okay, well, we'd like to open the lineup now to some partner networking. If anyone has any updates or events coming up, or Veterans Day ideas on the horizon, please feel free to share.
And we have a question from Linda Rockwell from Journey Care. Please go ahead.
Hi, thank you for taking my question. Dr. Shreve, you had asked a question or if there had been any problems with duplication of service issues between the VA and local hospice. And we had a veteran who was getting 3 showers a week from a home health aide through the VA, and I had contacted the social worker, the home and health aide services social worker at our nearest VA hospital, and she said that that is not considered a conflict of interest. But then apparently, some further down the line, there was a conflict of interest. Could you speak to that, or how to pursue that? A CNA from a hospice may not necessarily duplicate the service, or is it a duplication?
Wow, that's a really good question and a tough one too. This is an area where I'm going to describe it, and I want to let you know I don't have a definitive number that I can say. This is the exact number where duplication occurs. My point by this is my understanding of the conditions of participation is that really the hospices are to provide the needed care for the terminal illness, and oftentimes that can include some homemaker home health aide time coming into the home. One of the benefits is that oftentimes dually eligible veterans can receive some support from their VA as well. And that's a bit of a balancing act, Linda. And I think the VA person who was overseeing that home health aide may not have completely understood the intersection, if you will, between hospice care and what that veteran was eligible for under their VA benefit. So I think it sounds like you had an open conversation, a dialogue with your VA about it. It sounds like you've enlightened them, and I'll say, and I welcome input from others on this call about it, that hospices need to provide what you're required to under the conditions of participation. But for many dually eligible, for veterans that are enrolled and have access to some VA benefits, oftentimes they can supplement that care. And sometimes, and I'm not trying to, I'm not a lawyer, but sometimes that additional care can be provided and perhaps can be justified under some comorbidities that are not necessarily the terminal illness itself. So if it helps out and it makes sense for the veteran and their family, I think all the better. And where duplication occurs is often not a black and white issue.
Thank you.
Did I avoid really answering that well enough, Linda?
No, I think it's a rather grayish area, and it's hard to be definitive with any particular situation.
Mm-hmm. It really is almost on a case-by-case basis, and I've heard discussions that cover and been a part of decisions that really cover that entire spectrum. But, I guess the fear from the VA perspective is, hospices will just, push all the homemaker home health aid to the VA and cost shift, if you will, to put that cost on a VA and it'll cost the hospices less. I've not seen that, but at the other side, the VA is going, oh my gosh, we need to make sure the hospice is doing what they're doing. But boy, if this veteran is eligible for additional services, boy, all the better for the veteran and the family.
Yes, thank you. That's helpful.
Sure, Linda. Good question.
And again, that is *1 for questions or comments. And we will take our next question from Tracy Salin from Fairview Range Home Care and Hospice. Please go ahead.
Hey, hi, Tracy.
Hi. My name's Tracy. I'm a billing specialist here, and I'm also a veteran volunteer and kind of taking the reins with the We Honor Veterans project here. And I was just going to further comment on all of the questions with duplication of services. We've had some unique, more so on our home care side of coverage with duplication of services, or who's going to provide what and who will pay for it. We, for example, had a Medicaid HMO and VA alternating paying for coverage of nursing visits based on what they were providing, because if the VA was directing INR tests, then they would pay for it, but if they wouldn't pay for other type of services that maybe MA would pay for. My best advice, I guess, is just making sure that you're documenting that information very well. I recently came across that with the Veterans Choice Program. Just this week, we had a client that was referred to us from the VA for home care services. They authorized to pay for the service, and then we got a call for Veterans Choice that they would pay for it, and they would authorize it, and then we had to go through them. And there's a lot of questions on what are we supposed to follow with that. And fortunately, they were easy enough to understand that we were kind of caught in the middle as a provider. And I always advise from the Veterans Choice Program, they would drop their authorization, and make sure that I document it really well, because when you come in for payment issues as a biller, that's the best thing you can do, is make sure you have all of your communications documented very well, who you talk to and when. That eliminates a lot of that gray area confusion.
Yeah. Boy, you brought up a number of things that have been really a top priority for VA and that whole Veterans Choice Program. And I want to try to remain, as positive as I can on this call, but I also want to share pretty candidly, and I feel like you're saying it in a different way. It added another layer of bureaucracy to a lot of these referrals, and VA is working very hard with Congress to simplify that and to streamline how that Veterans Choice Program works. And home care is really one of the top priority areas. So I know it's been phenomenally active in our VA interactions with Congress in proposing legislation.
Oh yeah, it's been going, and I'm just going to say they've been very supportive of us. And the Veterans Choice representative was very supportive as well to the dilemma that we're kind of in the middle of. So it's, I can't complain about it. I just hope that it gets, we get better clarification in the future. Many
Agreed.
of people pass on into our hospice service, so it's just, the whole thing's very gray for us.
Yeah, I agree with you.
Okay.
And again, that's *1 for questions or comments. And there appears to be no questions or comments at this time. Actually, no, we just got one. Kathy Jarman from Heartland Hospice. Please go ahead.
Yes, hi. I was just wondering if people have some updates on what their HVPs are doing, the hospice veteran partnerships in their area. I'd love to hear success stories in those organizations.
Wow. This is Scott. I mean, the hospice veteran partnerships is really that they are the foundation for the We Honor Veterans program. So I think they're still evolving. And Catherine's welcome to correct me, but I think we're over 1,200 veteran community partnerships now. This is expanding that hospice veteran partnership concept to other non-hospice organizations, community partners, I think they're referred to as. So, I bet you there's a lot of really big success stories there.
And we'll take our next question from Vanessa Salinas from Providence Hospice, Anchorage. Please go ahead.
Oh, hi. I didn't have a question as much as I wanted to talk about the fact that we have a great relationship with our VA here, and we just started doing the penning ceremonies, and our representative from the VA, Donna Bacon, who is a palliative care social worker, makes an effort to come to everyone and to make sure that she introduces herself to the family and the veteran, whether they're on the veteran services or not. And it's really opened up and strengthened our relationship with the VA. We kind of love what we're doing. And that's all I had to say.
Oh, Vanessa, that's great to share. Are you from Providence, Rhode Island?
No, we're in Anchorage, Alaska.
Anchorage, Alaska, wow.
And we have a huge veteran population. And the other thing that has kind of rollerballed when I'm the volunteer coordinator, and we signed up to start this program about a year and a half ago, and we just started doing the pinning ceremonies. Well, now we're finding that probably a third of our patients are veterans, and the social workers and the nurses are giving me more requests for pinning ceremonies than I can actually do in a week.
Wow.
We have an active duty, actually a reserves. One of our chaplains in home health care is Army Reserves, and he does the pinning ceremony, which is absolutely wonderful. I don't have a military background, so he's teaching me a lot about military culture, and we're all learning from each other.
Nice. Very nice. Those pinning ceremonies are powerful.
Yeah,
Oh yeah, hi Vanessa. It's Catherine here. I'm happy to hear that things are still growing and moving along for you, and looking forward to seeing what we can figure out as far as a Veterans Day event for you guys to get the word out.
Oh, thank you so much.
Yes.
And we will take our next question from Arlene Steputat. I apologize if I mispronounced your last name incorrect. And she's from Visiting Nurse and Hospice of Santa Barbara.
So Arlene works just fine. Steputat's quite a mouthful. I'm in California, and, there's only 2 hospice veteran partnerships in our whole state. So the one that's closest to us is several hours away. We do phone in to hear the activities, but, we've never been able to actually go see them. But I want to share something that we created in our own community in Santa Barbara County, and we call it VetNet. And the net stands for both safety net and networking. And every other month we host a luncheon that's open to all service providers that are working with veterans in our community, and provide a focused program from one of our partners to highlight what they're doing in the community. And then a lot of it is designed for people to share information and announcements. And it's just been a very successful model because it's not necessarily hospice per se, but it's very veteran-centric. And the partnerships have allowed us to really step up as a team to help veterans that are struggling in our community. And out of that, we have created a homeless veteran coalition that is meeting after these meetings. So it doesn't really count for us as a hospice volunteer partnership because it's not one of the official ones in California, but we're more active in that than we are in our HVP in Long Beach. So I just wanted to let you know that's what we're doing, and we've been doing it now for 2.5 years.
Wow, that sounds like you're really approaching almost a veteran community partnership. You might want to talk more to Catherine about that.
Yeah, well, we just wrote a press release just came out because our partner in the community is called the Pierre Clayson's Veterans Foundation, and they're the folks in our community that make sure that, there's a military ball and celebration on Veterans Day and that kind of thing. So I will forward Catherine the press release that just came out. It's been very, very powerful. And people from other counties are coming as well, because people work in isolation sometimes, and this way we can all work together. And then, of course, we present what our hospice does with pinnings and that type of thing. But, yeah, it's worked out really well, and it just came because nobody knew what the other person was doing with veterans in our town, and we just thought that was stupid.
Interesting. And I would have thought that there would be a hospice veteran partnership in the Los Angeles area that you could link more closely into, but I guess that's not close enough.
Long Beach. It's Long Beach.
Okay.
And that's, to me, a meeting at 8:30 in the morning in Long Beach means, it's either an overnight or I'm driving at 4 o'clock. And it takes the whole day for an hour and a half meeting.
Yeah.
So so that's why we participate, we call in and listen, but it feels kind of isolating because we can't participate in what they're doing.
Yeah.
It's a big state.
That's for sure. That's for sure. Thank you, Arlene.
Yeah, hi Arlene, it's Catherine. Definitely want to figure out what we can do to get you more involved, even if it's just calling in for the statewide HVP meetings, but also seeing about the possibility of your participation in a VCP. So yeah, definitely please reach out and email us.
Okay, will do.
Thank you.
And we will take our next question from John Dolezal from Serenity Hospice. Please go ahead.
Yeah, hi there. Thank you. I'm with Serenity Hospice up here in Portland, Oregon, and I've got two things. One, our hospice partnership, Ryan Weller coordinates a quarterly conference call. The geography up here is pretty big, hundreds of miles in any direction. And so we have a quarterly conference call and are able to, he'll do a presentation, often he'll have help from someone else up on the palliative unit, and then of varying topics, be it a disease state or services or something like that. And then we'll have a roundtable open discussion for Northwest-specific issues, and it's very helpful. The second thing is we are starting to, we have a lot of younger persons on our staff, and the difference between the World War II veterans, the Korean veterans, and the Vietnam veterans that we're starting to see. Often now, with like a pinning ceremony or something like that, the World War II veterans aren't really able to participate so much. They can accept their certificates and their pins and that sort of thing, but sometimes it's tough to have a conversation versus the Vietnam vets. But what we're finding is the psyche of some of these Vietnam vets is very, very different from the World War II vets, and we're starting to look for resources to train our staff on what some of these differences are. So I'd be interested to hear, we've done book reviews on the things they carried. There's a book by Marlantis, What It's Like to Go to War. We've done book reviews on that, but what other resources are there to help our staff interact better with Vietnam-specific era veterans?
Wow, and that was Don, correct?
John,
you asked, the $64,000 question, and much of soul injury gets to some of the issues that many Vietnam veterans face. We are soon releasing the updated ELNIC for veterans curriculum, which has military culture considerations, but I don't think it digs in as deeply as I'm sensing that you would like it to. I should be able to rattle off, a quick 2 to 3 resources for you, and I can't right now. But I want to look into this and talk with Catherine about that. We should have that right on the We Honor Veterans website. And if it is, Catherine, boy, please let me know. But I have not seen what I call readily accessible resources on how to be sensitive and aware of some of the issues in interacting with Vietnam-era veterans at end of life. The one, though, that does come to my mind, it's real interesting that you're from Portland, Oregon, and work with Ryan on a quarterly basis. Ryan and I participated in the Living with Grief series put on by the Hospice Foundation of America. I believe it was 3 years ago, and this was improving care of veterans with advanced illness, and Ryan and there was a Vietnam era veteran on that training program, which I believe we can still get for you, although I think what I'll call the accreditation expired, but the training video we could still get for you. They covered the Vietnam era wonderfully. It's a 3-hour Frank Cesno moderated interview with Vietnam era veterans and Ryan and Deb Grassman is on there too, talking about the soul injury. So that probably would be my number one reference at this point, and we need to expand on it.
Yeah, hi Scott, it's Catherine. Just to echo what you were saying, we do, John, on the We Honor Veterans website have a link to, veteran-related issues by trauma or war, and then under Vietnam War-related resources, we do have a few links to some useful information. For instance, unique health risks, Vietnam health history pocket card. There's a few things like that, but yeah, Scott, it's definitely something that we really need to expand upon, as soon as we can. I know that that's something that, a lot of people have reached out for as far as a resource goes, so we'd like to get up as much as we can. But for the time being, John, yeah, feel free to explore that and reach out to us, and we can pass along some more suggestions as well.
And John or others, if you want a copy of that Hospice Foundation of America DVD from a few years back, please let us know, and I'm happy to talk with the Hospice Foundation of America to try to get some copies out. I don't think we can get you accreditation, but I think we could get you copies of the training.
Yeah, we're definitely interested in that right away.
Okay.
And we'll take our next question or comment.
By the way, I didn't even think of it. Ryan likely has a copy of it. He was a presenter, and that may be a good starting point too. And I'll follow up though. But John, if you could email to the We Honor Veterans website so we can follow up with you, I'll do that. And I think I may have a copy or two, and we'll look and see if we could get any others.
Will do.
Thanks.
We'll take our next question from Bernadette from Hodges Funeral Home and Dignity Memorial. Please go ahead.
Yes. Hi, everyone. Again, it's Bernadette. I'm very interested in the most recent caller about the issues of addressing soul injury with Vietnam vets. And I think one of the things that really is a resource readily at hand would be cinema. 3 films come immediately to mind. One of them is, I believe it was called Born on the 4th of July with Tom Cruise. Another famous one was The Deer Hunter with Robert De Niro, Christopher Walken, and Meryl Streep. And then there was really a very difficult one called Apocalypse Now with Marlon Brando and Charlie Sheen. But what I'm thinking of in terms of the merit of cinema is that particularly these 3 films provide such an emotional immersion with issues that in many ways characterize the traumatic experience during that era in our country of Vietnam, and it could really expedite a certain grasp of what these men and women endured. So I'm signing off and eager to hear any comments that anyone might have.
Well, this is Scott, and I agree, Bernadette, in terms of the emotional intensity of those films. Thank you for sharing, and I like to think that we can also provide this audience with some techniques and some expertise on how to best respond to even anger and the impact that can have, 50, 60 years later, and that is both an art and a skill that is a challenge. If any of you have looked at the demographics of the growth of Vietnam era death rates, wow, it is really taking off over the next decade. And for those of us that have spent much of our careers caring for World War II veterans, things are going to change very rapidly over the next decade.
And again, that's *1 for questions or comments. And we will take our next question or comment from Joseph Shaley from Lutheran Hospice. Please go ahead.
Yes, hi, this is Joseph Shaley from Lutheran Hospice in South Carolina. I'm a social worker and volunteer manager here, and also have the benefit of being a veteran. And I wanted to respond or just add something to what the gentleman from Portland said. You know, I think one of the things that we benefit from when we do face a dearth of resources is that we can go straight to the veterans themselves. And not just the patients, but as we recruit veteran volunteers, we can address these topics with them specifically and get their input on how they think people from their wartime era, their branch of service, how they think they would be the most receptive to what we're trying to do, because at the end of the day, we are trying to honor their service and be a resource for them. And we can go directly to the people from that time period to try to develop how we move forward and then add the professional aspects to it based on their input. Thank you.
Joseph, this is Scott. I think that's a really good comment. And as you were talking, I was thinking, I don't think any of us want to make generalizations, you know, all Vietnam-era veterans are X or Y. I just don't think that ever works. But I really like that idea of going to the veteran directly and listening. So much of what We Honor Veterans is all about is that respectful inquiry. And so I think that's a great idea. And to hear that you're a veteran providing care and overseeing volunteers for veterans is about as good as it gets.
Thank you.
And again, that is *1 for questions and comments. And we will take our next question or comment from Kathy Jarman from Heartland Hospice. Please go ahead.
Are you there, Kathy?
It looked like she exited the queue.
Okay.
So we'll take our next question from Stephanie from Hospice at Home. Please
yes,
go ahead.
Hi. Can you hear me?
Yes, we can, Stephanie.
Okay, good. Well, I'm calling from a rural community in Michigan, and we have a hospice residence in addition to our in-home hospice care. We've got wonderful connection with our local VAs and VA facilities, but they're several hours away. And so my question regarding the CHOICE program, one barrier that we've run into is when our patients are very close to end of life and require routine level of care or respite care and have full VA benefits, they're required to receive those services at the VA facilities. And so my question was, we've tried to work with our local VAs to, develop some kind of contract so that our patients are able to pass closer to home and to be with family. Is that something that they're working on with the CHOICE program to make more accessible to veteran patients so that they're able to pass closer to home?
Yeah, you're not in the Upper Peninsula by any chance, are you?
No, we're actually in Southwest Michigan.
Southwest. First off, the CHOICE program has actually had very little impact on hospice. So hospice care is really not part of the Veteran CHOICE program at all at this point.
Okay.
What I don't know, but let me clarify with you that you talk about your hospice residents, and what I understand as a hospice resident can be a personal care or assisted living facility, that there is generally some private pay amount of it by the patient, and then a routine home care being delivered in the residence. Or are you talking about a general inpatient unit that you have?
It's actually both. It's licensed as a skilled nursing facility, but it's specifically a hospice residence. So we only have hospice patients. We provide general inpatient care there, but we also do have a routine level of care option and a respite option that we provide there as well.
Okay. The VA is allowed to pay for the general inpatient care, so that's within our legislative mandate from Congress. What we're not allowed to pay for is anything that is not a nursing home, assisted living or personal care. The VA is not allowed to pay for any of that. And in terms of skilled nursing or nursing home level of care, most VAs only set up a limited number of contracts in an area, and so the choices can get limited in rural areas as to who VA has a contract with in a community nursing home. So I don't have any easy answers other than the GIP VA can, and it's in our national policy that has to be available to enrolled veterans. So that is an option, and I think to me it's unreasonable to mandate that a veteran travel 2 hours if there's a general inpatient facility, in their community, and it's going to be provided for a relatively short amount of time. But the residence is a more difficult issue that I think Congress would need to act on before VA would be allowed to provide that.
Oh, okay. Yeah, and we've had no trouble with the GIP level of care with the VA. It truly is, our folks who, are preeminent, they're on a pretty significant decline. Families no longer able to care for them at home, and so we're looking at placement options. And when they get to that point, they, if they are going to use their VA benefit, and their VA benefit is, their primary benefit, they have to go, several hours away at that stage. So, but that's really good information. I appreciate getting some more input on that.
Yeah, I wish we could. It just anyway. I'm sure there's lots of reasons why the residences aren't uniformly covered, but it just makes it difficult trying to comply with the laws that we have to. So I'm really glad to hear, though, that you have a good relationship with the VAs that are as close to you as possible, and try to work things out to minimize the burden on veterans and their families.
Thank you.
Again, that is *1 for questions or comments. And we will take our next question or comment from Rex Reeve from Sacred Heart Hospice.
Yes, we are a 4-star level partner. We submitted a story several years ago, probably now, about Jerry Green. I'm not able to find that anymore in the We Honor Veterans, stories from our partners. I wanted to show some of our new hires that have just come on about, some of our background. And I was just wondering, is there a way we can archive that?
Hi, this is Catherine. If you'll send us an email and with, again, your organization's information and maybe just a bit about the story, we'll do some digging into our archives and see what we can find. I'm not sure if we still have that available, but we'll do our best to find it.
Okay, and who would I send that email to?
You can send it to the General Veterans inbox on our website. So that's veterans with an S at nhpco.org.
Okay. All right, I will do that then. Thank you very much.
Okay, sure.
Once again, that's *1 for questions or comments. And there appears to be no questions or comments at this time.
Thanks very much, everybody. And Catherine, I'll follow up with you. I really like that idea. I think John brought up about expanding our resources for working with Vietnam-era veterans, so I'm happy to work with you on that.
Yeah, definitely. I'd love to get a hold of the HFA video, and again, put it up if it's not for accreditation, see if that's okay. Mm-hmm. But yeah, thank you everyone for your time and for being on and for your continued efforts and being part of the We Honor Veterans program. We really appreciate all that you do, and please feel free to continue reaching out, sharing your stories, letting us know what's happening, and we look forward to the next call and hearing about your Veterans Day activities. So thank you everyone. Have a great afternoon.
Thank you.
And this does conclude today's presentation. Thank you for your participation. You may disconnect.